Now, stakeholders are calling for efforts to accelerate access to justice for victims of gender-based violence, or GBV, if you like. According to the executive director of the Association of Media Women in Kenya, Juddie Kaberia, the surge in cases of GBV is alarming, yet perpetrators still escape the wheels of justice. Kaberia is challenging the judiciary to fast-track the process of setting up a special unit to clear the backlog of GBV cases pending in court.
According to the 2014 Kenya Demographic and Health Survey, the most recent national data, over 40% of women in Kenya reported having experienced some form of physical or sexual violence in their lifetime. According to the executive director of the Association of Media Women in Kenya, Juddie Kaberia, the surge in GBV cases is still alarming despite the stringent legislative and policy framework which criminalize GBV in the country.
Whereas progress has been made to tighten the laws against GBV, establish structures such as the gender desks, polycare, and an emergency reporting system, the upsurge of cases is an indication that either these changes are insufficient or incommensurate to the weight of GBV crimes.
We must make it easy for victims of SGBV to access justice. And that is where we are saying there's a big failure.
It is for this reason that AMWIC, in collaboration with the Urgent Fund Action Africa, is challenging the government to eliminate the bottlenecks of access to justice for victims of GBV.
We urge the judiciary and the government to hasten this process by allocating the necessary resources to pave way for the establishment of the special unit to clear the backlog of GBV cases and hasten the process of justice.
It is very important that we're investing a lot of our efforts in prevention and mitigation of GBV.
The stakeholders are also calling for professionalism in the handling of GBV victims.
And we have established that victims of GBV fail to report cases due to fear of the police, bribery, and further victimization.
For Prime Edition, I'm Safin Acheng Ouma.